Savita Dental College Lecture Series in General Pathology. The topic of discussion is pathogenesis of diabetes mellitus. Before going to the pathogenesis proper, we have to see the risk factors of diabetes mellitus. There are two risk factors, genetic factors and environmental factors. Genetic factors include HLA gene defect and polymorphism in the T cell regulators, and environmental factors include viral infections like mumps, Coxsackie B viruses and all. Coming to the pathogenesis of type 1 diabetes mellitus, there is a failure of self-tolerance in the T cells. So, these autoreactive T cells will destroy the beta cells of the pancreas, cause diabetes mellitus. And the pathogenesis of type 2 diabetes mellitus is not the destruction of the beta cells by T cells, it is mainly due to insulin resistance and beta cell dysfunction. And what is insulin resistant? It is defined as resistance to the effects of insulin on glucose uptake, metabolism or storage. And these beta cell dysfunction is inadequate insulin secretion in the presence of insulin resistant and hyperglycemia. Coming to the pathogenesis proper, the increased appetite, reduced exercise, increased nutrient intake and increased metabolic efficiency all will leads to increased adiposity and cause obesity, and this obesity again will cause low grade inflammation, activation of reactive oxygen species, dyslipidemia, adipokines and beta cell stress, and that all will leads to insulin resistance and beta cell dysfunction of liver, muscle and pancreas, and this will cause excess glucose production and impact glucose uptake and utilization, and that will lead to type 2 diabetes mellitus. Simply we can see the pathogenesis. Normally the pancreas will produce insulin and that will take the glucose in the blood and moves that to the cells. But in diabetes, the pancreas produce less insulin, there will be more glucose in the blood because of this, and this less insulin will move less amount of glucose to the cells. Coming to the pathogenesis of complications of diabetes mellitus. For atherosclerosis, the macrovascular disease, the decreased vascular elasticity is the reason. For nephropathy, increased deposition of basement membrane material in the capillary wall is the main cause. For neuropathy, increased vessel permeability to protein that will deposit in the nerves and neurons. But in retinopathy, there will be increased activity of vascular endothelial growth factor that will cause neovascularization inside the eye and retina that will cause diabetic retinopathy. That's all about the pathogenesis of diabetes mellitus. Thank you.